Turn the music on. So Manor is currently back on Saturday. I need to join it on here, don't I?
Link it for you. Here we go. So, captions. Or chat or something like that. Audio. But it's sorry, live on YouTube a minute.
So you're pushing that to change that?
Yeah, and also this as well.
It's back to front now.
This is, yeah, because it's like a reflection, isn't it?
It's not like that last time, I don't think.
Because it's right on that one. Because it's like two things going that way, it comes out opposite. That's how it was last time.
Really?
Yeah. Because obviously you have the same on this side, which is central there, it's central there. Because it flips.
So is this on all the streams now?
This will be in the next few seconds. So on YouTube, you can actually put one bar to watch it. So that's a few seconds.
Start.
Okay, hello and good evening, and thank you for coming to our Women's Health Talk with Xcel Health. My name is Tiffany Sequeira and I am a specialist pelvic physiotherapist at Xcel Health. And tonight I'm going to be talking all about women's health, pelvic health, and how I, as a physiotherapist, can help you with common symptoms that women tend to get, but actually because we don't talk about it, because women don't know about it and know what our job is, they don't seek the help they need. So for the next kind of half hour, 45 minutes, we'll be running through common symptoms and common ways that we can help you as well. What we'll be doing is running a question box. So any questions, please let me know. And at the end, there's time for questions as well. Let's move to the next slide. Okay, so a little bit about me first of all. So I am a physiotherapist by trade, but where other physiotherapists specialise in bad backs, bad knees, bad hips, I specialise in, for want of better words, a bad pelvic floor. So where things down below aren't working quite like they should be, or how they used to be for you. So that's when my job really comes in. I do a lot of social media work, so I run an Instagram account called Gynae Girl. So yeah, if you'd like, give me a follow. And the main reason I created that was because I felt like there wasn't enough info out there for young people, for women of all ages, about what's normal, and how can you access that help. And I think a big issue I have is actually as young people and throughout the ages, we don't talk about these things. They're all very taboo, but actually 9 times out of 10, we're going to experience a lot of these women's health symptoms. But if we don't talk about them, if we don't know about them, we're not going to seek the help we need. What else have I got? I have a contract with Superdrug, so I work with a lot of brands like Tenor, Always, a lot of their sexual health products. So when they get released, they all get run by me. Because of my job, I look at how they're promoting it, how they're advertising it, which is a really nice job to have. I'm an ambassador for Ovarian Cancer Action, so a lot of my work involves campaigning, making sure women know the signs and symptoms of ovarian cancer. Again, if you know more, you can then get help a lot sooner. And then finally, I also am a Parliament advisory. So for the last few months, I've been campaigning with women, trying to get women to seek the help they need, but also be aware of it. And a lot of our work at the moment is looking at how the government and the NHS guidelines target women and support women throughout the ages. Lovely. So a little bit about pelvic health physiotherapy. So like I said, where other physios treat bad backs, bad knees, my job is to look at the pelvic floor. And it's a type of physio that people tend to be a little bit, they're not too sure about it. They think, is it to do with your pelvis? Is it to do with your back? It can be, but a lot of it is also to do with internal. So I look at things like bladder, bowel, urine, pregnancy. I look at prolapses and sexual dysfunction. So a lot of the time physio looks at getting people kind of back to walking, running, doing sports, but actually my job looks at people and thinks, actually, how can I get you not waking up at night time to go for a wee, or finding sex comfortable again, or not having urine or fecal incontinence. And actually that is a big part of people's lives and it can really be life-changing. But lots of people don't come to see us because, one, they don't know what our job is, and two, they think it's taboo and they think it's something that we don't deal with, or it's something they don't feel comfortable talking about. But that is literally my job and we're here to help you. So please, 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 if you're somebody that's living with these symptoms, if you're somebody that knows somebody struggling with these symptoms, please send them to come and see us because there's so much we can do to help. I deal with all the pregnancy-related symptoms, so kind of pregnancy pain, post-pregnancy tears, diastasis, so where your tummy muscles start to separate. We run mummy MOT, so giving you a full head-to-toe checkup once you've had baby to see actually what's going on, what can we do to help you, and how can we get you back to being not just mum, but you as a person yourself. All the menopause symptoms, so a lot of the menopause symptoms, unfortunately, link to your pelvic floor. So things like vaginal dryness, dropping in estrogen, incontinence, symptoms of prolapse. Again, that really lends itself to pelvic floor physio, and that's where I can really help. And then finally, also coccydynia. So that's commonly where people tend to get a lot of lower back pain or pain right on the tip of their tailbone. And again, it's one of those things that people tend to go to maybe physio, to the GP to see. They go back and forth lots, but actually it's a lot more internal, and that's where my job comes in to really help. My job involves everything. There's nothing that's too taboo or awkward to talk about. I've seen and heard it all, but my job involves a lot of advice and education, manual work, having a feel, seeing what those muscles are doing, seeing what your body does in different positions, and really treating and working on what we see. So it's very patient specific, and no patient is the same and no treatment I do is the same. So it's really worth coming to take a look and seeing how we can help you. So I'm just going to go for a bit of really basic anatomy, so the kind of the boring part of the talk. But your pelvic girdle, I think it's always good to have a bit of knowledge about what your body does. And so your pelvic girdle is 2 crests. So if you look at the picture there, the 2 arcs, they're your iliac crests, they're your hip bones. And I like to think of it as a big loop. So it goes round, and then what you've got at the front is your pubic bone, so the bony point on top of your vagina. And then you've got your sacrum and your tailbone, which are the bony points right on top of your bottom at the back. And all these bones work together. So it works as a loop, and it acts as a good purpose for giving your organs supports and protection, your muscles attached to these joints as well. And it plays a role in absolutely everything we do day to day. So walking, running, sitting at a desk, going to the toilet, when we're pregnant and carrying baby, these bones and these joints go through a lot of pressure every single moment of our lives. Even when we're lying down in bed, if you're lying on your side, your hips moving across, it's a joint that never ever rests, and unfortunately it lends ourselves to a lot of pelvic floor symptoms as well, which is where my job comes in. Which then brings us onto your pelvic floor. So people tend to talk about their pelvic floor, but I don't think people really know exactly what it is and what it does. But your pelvic floor is essentially a collection of muscles, so it's not just one big muscle. If you look in the picture, there's lots and lots of different muscles that all work together, which is good when they do work together. But actually, for a lot of us, these muscles aren't working either as they should be or as they once were and as we remember them. So your pelvic floor is a bit like a hammock. It starts on your pubic bone at the front and goes right underneath and inserts at your tailbone at the back. It, like I said, is a bit like a hammock, so it works really hard all the time to hold our organs up, so our bladder, our bowel, our uterus. When you want to go for a wee or a poo and there's not a toilet nearby, that is your pelvic floor working really hard all the time. When you're pregnant and you're carrying baby, again, that is your pelvic floor that's holding everything up all the time. And like I said before, just like your pelvis, it's a muscle that never ever rests. At night time, it's stopping you constantly having accidents. During the day when you're walking, running, it's stopping you leaking. So it plays such a vital role. But unfortunately, and I find for women in particular, because it's not a role, it's not a muscle that we see, it's not like your calf muscle or your shoulder, your quads, your biceps, because when you have an injury, people can't see it, they then don't seek help, they think it's something they need to keep quiet about. And actually for us, for me as a pelvic floor physio, the sooner you seek help, the sooner you come to see me, the better, because there's so much we can do to help. The pelvic floor also has a lot of roles in terms of sexual function. So there's a high incidence of a stronger pelvic floor, the more and the better arousal will be. And also when you're pregnant and you're giving birth, the pelvic floor plays a really vital role in labour. So that second and third stage of labour, your pelvic floor works really hard. So if you're somebody that has had a bit of a traumatic birth or a really long old labour, even if that was 10, 20 years ago, I can almost guarantee you there will be some form of pelvic floor dysfunction where that pelvic floor just isn't working as it should be, and that has probably lent itself to those pregnancies and births that you had. People often ask me, how do I know if my pelvic floor is working? So it's a hard one because a lot of symptoms mask themselves as pelvic floor dysfunction, or people think it's back pain, or I'm not strong enough, or I've got a weak bladder, but actually it's that pelvic floor. It's such a vital muscle, and when it doesn't work, it can affect us in a variety of ways. Common things we see is constipation. So for some people, it's not just about your pelvic floor being weak. For some people, their pelvic floor is too tight and it never relaxes down. And if you think about going for a poo and passing stools, you need that pelvic floor to relax so that stools can go through. Unfortunately, for some people, where that pelvic floor is very tight, it then results in them becoming quite constipated. And that can happen for years and years. Quite often with the ladies I see, this has been happening since they were a child and they've really struggled to go to the toilet. And when we do a pelvic floor assessment, actually there's parts of that pelvic floor that are just not relaxing. And that's when my job comes in to work on getting those muscles to work when they need to, but also relax when they need to as well. Incontinence is another one. So if you think of what I said, that pelvic floor acting like a hammock, holding up your bladder all the time, what should happen is when you need to go for a wee and there's not a toilet nearby, that pelvic floor works and holds the bladder up really nicely until you get to the toilet, when the pelvic floor relaxes and then you can go for a wee. Quite often with the pelvic floor, especially after, if we do a lot of heavy lifting, if we've had a lot of births, if we've just got weaker as we've got older, that pelvic floor doesn't have that strength that it used to, and it can't hold your bladder like it once did. So when you need to go for a wee, you either experience a little bit of incontinence, so trickles of wee, or completely wetting through, or you feel like you can't hold it for as long. So you might feel like you're needing to go for a wee more and more, or you're waking up at night time to go for a wee when you didn't used to. And again, that's a real sign of your pelvic floor not working as it should be. And it's upsetting because I think, actually, do you know what? These things really affect your life. They are really life-changing. If you're needing to wake up in the middle of the night, that's your sleep. If you're needing to get off at different stations or tube stations to go to the public toilets, if you're going out and you're already, the minute you go out, having to think, where is the nearest toilet, that really affects your life and it affects everything about you. And something as simple as coming to see me and having a pelvic floor assessment, getting treated, prioritising yourself as a woman is so important. So I really, really would encourage you, if that's you or somebody you know, to come and see how we can help. Other symptoms of pelvic floor dysfunction: back pain. So your pelvic floor also works in conjunction with your glutes, so your bottom muscles and your tummy muscles. And quite commonly I find ladies who have had chronic back pain, the back pain that you've been to physio, it's not quite got better, you've had the scans, actually your back looks all right, but they've got this nagging back pain that aches during the day, it gets worse at night time, it's very low down. Quite commonly when I do an assessment, it's that pelvic floor that's weak, and actually where the pelvic floor inserts, if you remember I said from your pubic bone to your tailbone, imagine this muscle being very weak and it's pulling at the joints. And if you think during the day that muscle's had to work really hard, by the end of the day when it's pulling at these joints, you're going to feel sore, you're going to feel achy, and you'll find that no position you do, no exercise you do is going to really take that slack off, because actually it's all internal. And again, that's where I would be looking and assessing and seeing actually what's going on with this pelvic floor, how can we get it stronger, but not just stronger, but how can we get it stronger for you and the job you do, the role you do, the sport you do, how can we get it stronger for you as a lady? Another common one is pain during sex. So for some people, what I'll often find is their pelvic floor is either weak in some areas or working too hard in other areas. And if you think about sex, your pelvic floor needs to be relaxed. Anything to do with penetration can be very, very uncomfortable. And again, that also is more common during the menopause. And when I do my menopause checkups for ladies, that's what I'll also look at and discuss to see how I can help. And then finally, the feeling of an internal dragging. So a big scare people tend to have is about prolapse. And people often think with a vaginal prolapse, it's everything flowing out. It's not. A prolapse can be absolutely tiny, but we'll talk about it a little bit more later on. But the feeling of something dragging down below, people often say it feels like a used tampon, or that just something down below doesn't feel right there. It's quite commonly a sign that your pelvic floor, that hammock, is not holding up your organs as it should do and as it once did, which means actually, imagine it's holding up your bladder, your bowel up there. If it's a bit weaker, everything's going to protrude down slightly, which during the day, you're on your feet all day, you're busy, you're looking after children, you're doing your job, that muscle's going to get tired, drop down even more, and then you will get these symptoms of prolapse, so that dragging, that aching feeling, that feeling that something's just not quite right down there. And that's where my job really takes effect. I'll look, I'll see, have a feel and see what is going on for you. So a quick one just about the bladder. So I like to tell people to imagine the bladder a bit like a balloon. So it's a low pressure organ, so it generally sits, it doesn't do too much. It stretches and it relaxes back down. And what happens normally is that your bladder, so I must imagine like a water balloon, it's stretching as you're drinking more and more. What eventually happens is the stretch receptors in your bladder send a signal to your brain saying, right, we've stretched enough, we now need to go for a wee. Your brain tells yourself, right, let's find a toilet. You find a toilet, that bladder then relaxes down and you go for a wee. And this is how a generic normal bladder tends to work. This also protects your upper urinary tract and your kidneys. But commonly, if your bladder's not working as it should do, common things I'll tend to see in clinic is recurrent urinary tract infections. And quite commonly, ladies will say, I've gone to the doctor, they've done a urine dip, they've said there's no infection, but it's burning, it's feeling uncomfortable for me. recurrent kidney infections, and also recurrent feelings that you need to go for a wee, but when you go, you're only doing a small trickle. And that is because your bladder, that balloon that's stretching, is sending messages up to your brain saying, actually, I need to go for a wee, but actually there's not a lot of wee there for you to use. So it's your bladder not sending the right messages. So normally your bladder fills at 0.5 to 5 mils per minute, and a normal bladder can fill up to about 300 to 500 mils. So it stretches, 300 to 500 mils is in there, sends a signal to your brain saying, I need to go for a wee, you go for a wee, bladder relaxes, and out you go. Unfortunately, with women's health conditions that I treat, this bladder becomes what we call hypersensitive. So imagine when you've got a cut or a bruise on your arm, you're more aware of it. If anything nudges it, you feel like, oh, that's a bit sore. That's the same with that bladder. Those receptors are firing straight away. So all you need is a tiny trickle of urine in there, and your brain's already telling your body, I need to go for a wee, which means you're getting up in the middle of the night, you can't do your job properly, you're constantly thinking, where is the nearest toilet? That's where my job comes in, and working on retraining that bladder, getting that bladder used to filling up to a normal capacity again, and getting your body used to that feeling of feeling full before you need to go to the toilet. I think I've just covered this really, but yeah, normal bladder function, so 400 to 600 mils, so a pint of water is really what you should be able to fill up your bladder with. But often I see ladies way down the line where actually they need to go for a wee, and when they measure it, they're producing 20 mils, a little trickle of urine, or they're waking up in the night 5 or 6 times to go for a wee, and it's a small amount. And I think, like I said before, it's life-changing. It really affects your life, and you can't live your life like that, and that's where I can come in and help. So next I'm going to talk a bit about incontinence, and it's something I'm very passionate about because people often find as they get older think urine incontinence is something that happens to us. It's something that we have to accept. As we get older, we will leak, or they call it mum bladder. When you're running, laughing on the trampoline, it's expected for you to leak urine. Nobody should be incontinent at any stage of their life. So it's a symptom. It's absolutely not a diagnosis. So what is causing that incontinence? And that's where I will come in to look and assess and see. Urinary incontinence affects 1 in 3 ladies in their lives, but actually, I think the statistics is only 1 in 12 will seek help, which is shocking when you think if you've got a bad back or a bad knee, you'd be straight on the phone to the doctor, to the physio to come and seek help. But something as life-changing as leaking urine, as wetting yourself, people don't seek the help. And I don't know if it's because they don't know we're here, if it's because they feel like it's a bit taboo. It's not. It's what we're here for, and it's what I wouldn't have my job if people didn't come and see me for these things. So it's so important to come and seek help. There are 3 different types of urine incontinence. The first is stress incontinence. So that is where, again, imagine that pelvic floor like a hammock. If you're coughing, sneezing, laughing, any pressure on that pelvic floor, normally your pelvic floor stays nice and strong, holds everything up. But actually things like coughing, sneezing, laughing, pelvic floor jumps down, and that causes that leakage. The next one is urge incontinence. So that is where, say you're out shopping and you need to go to the toilet. Normally you can hold on until you can find a nearest public toilet. With urge incontinence, you need to go there and then. You cannot hold on. Or, for example, you put the key in the door, you need to go for a wee straight away. Again, that's that pelvic floor not having that endurance like it once did. It's like any other muscle. It just can't hold on for as long as it used to. And then you've got a mixture of both, which is common, to be honest. As that pelvic floor gets weaker, it doesn't have those short twitch fibres to work really hard when you need it to, but it also doesn't have that endurance to help you and keep you ticking over until you find the toilet. In terms of incontinence management, there's so much out there and there's lots of different options. Unfortunately, people try and look for a quick fix, or they see, I think when you Google online, they talk a lot about mesh surgeries and things like that. That is absolutely an option, but the NICE guidelines, the guidelines that the NHS states, show that pelvic physio is the first line in treatment. So the first line treatment to have and they show that with people who get pelvic floor physio, 90% of them receive some improvement in their symptoms, so already that's a big difference. But 60% of these ladies don't need to go for any further treatment. So actually, if you're going to know that 90% of you that come through my door are going to feel better, and 60% of you, that's going to sort straight away, it's such a big thing to come to pelvic physio. When you think about all the other options that you've got, so mesh surgery, medications, things like Botox to stop your bladder working as much, absolutely they are options, but they're very invasive, and pelvic physio is not invasive. It's very much about empowering you to do the work, to know how your body's working, to get you stronger, and stronger for life, to future-proof your body so you can do the things that you want to do without having to worry about toileting and things that you shouldn't have to worry about anymore. So a little bit about what happens in a pelvic physio appointment. People often wonder where, like, and my friends ask, what do you do in your job? What do you talk about? And I think sometimes the barrier to coming to see me is actually, it's quite daunting, and not knowing what to expect can be a lot. And so a lot of my job involves, first of all, having a long chat. So we have 45-minute initial assessments, and that's so it gives me enough time to see what's going on, but also you enough time to tell me what's going on. It's not going to be a quick 15-minute session, because I want to know exactly what has been going on with your bladder and bowel, what has happened as a child, what has happened when you were giving birth, during pregnancy, as you've got older, have you had the menopause? Talk me through your birth history, any joint pain that you've had, because actually it's really painting a picture and piecing together puzzle by puzzle what is going on. And the more I know about you and the more I can assess you, the better I can treat you. So talking about things like I said, toileting, sex, birth history, MSK pain, all those things that probably in other appointments they don't have enough time to talk to you about, or you're rushed in and out. We have the time here to really help you and listen to you as well. I think a lot of ladies don't feel like they've been listened to, and I can appreciate that, and that's what I'm here for. I will then do an assessment of your joints. So if you're complaining of any joint pain, have a look at kind of your back, your hips. Is there any tension there? I'll have a look at your abdominal muscles, so your tummy muscles, because they play such a vital role in your pelvic floor. And then I'll do the pelvic floor assessment. So that is, if you're happy to, an internal assessment, so bare below the waist, and then it's a finger assessment off your vagina, seeing what those muscles are doing. Are they relaxing? Are there areas that are too tight? Are there areas that aren't working hard enough? And then seeing what happens when you do your pelvic floor exercises. Is your pelvic floor able to hold for long enough? Is it able to short fire? And that really gives me an idea of what is going on and how I can treat and help, and looking at the tissues and seeing actually, is there signs of vaginal dryness, a lack of estrogen? How can we change and help you for the better? So it's a really comprehensive, in-depth assessment, but that's absolutely what you need, and as a woman, what you deserve. So, it's really worth that 45 minutes that you're in here for. And then, treating what we find, so very patient-centred. Just going to have a little chat about pelvic organ prolapse. We kind of touched on it earlier, but a big fear, and people tend to come and see me with a prolapse 5 or 6 years down the line. They've had these symptoms of a prolapse, it's something dragging down below. Maybe when they go for a wee and they wipe themselves, they feel something, or when they're running, they can feel like something's just down below that wasn't there before. Again, commonly with ladies, unfortunately, is that suffering in silence, thinking, oh, well, this is normal, I've had a few children, or this is normal, I lift heavy weights at the gym. It's common, but it's absolutely not normal. And unfortunately, at the moment in clinic, I get a lot of ladies that have seen me, like I said, 5 or 6 years down the line, when actually if they saw me 6 years ago, they saw me right at the start of these symptoms, I could really help, and I can still help now, but my biggest push is the sooner you come and see me, the sooner you take that jump and that plunge of looking after yourself, listening to your body, prioritising your own health, that is when I can help. So again, with prolapse, generally things like coughing, sneezing, laughing, being on your feet all day will make those prolapse symptoms feel a lot more. And a big part of pelvic floor physio is looking at that prolapse, seeing what grade it is, where it is, what is prolapsing, and how can we either help to keep those symptoms at bay, manage those symptoms or make them better for you as well. Surgery is not the only option for a prolapse, and actually the first line of treatment for prolapse is pelvic floor physio again, so it's really, really worth its weight in gold. This is a nice diagram. Well, some people like it. It just helps to explain prolapse in an easier way. So it's called the dry dock theory. What I want you to imagine is the water at the bottom of the boat. That's your pelvic floor. So that is keeping the boat up, it's keeping it floating. You've then got your ligaments, so they're the ropes that are tying the boat to the shore, I guess. And then your boat is your pelvic organs. What can happen with time is either the rope on the boat starts to break off, so that is your ligaments, your pelvic ligaments not working as they once were, which causes that boat, so your pelvic organs, to start to drop down a little bit. The other option you have is that also that water starts to decrease, so your pelvic floor is weaker. If that pelvic floor gets weaker, it puts more pressure on your ligaments, you're getting more pelvic pain, and naturally that organ will start to drop down. And then if you look on the far left, you've got somebody jumping. Again, that's pressure on those pelvic organs, that if your pelvic floor, that water isn't up there to keep that boat up, those ligaments aren't working as they once were, a prolapse is inevitable. So it's not just about pelvic floor physio treating these symptoms, it's also about future-proofing you, coming to get a check to see, actually, is everything working as it should be? Everything feels fine, but actually what can I do as a woman prioritising my health to actually keep all these symptoms at bay, to keep myself working well, and to keep myself having the lifestyle that I want to lead? It doesn't just have to be physio for a symptom, it can really be physio to future-proof you and keep you doing the things you want to do. This is just another sort of example of prolapse, and just different types. People often think, oh, it's just one or another, but actually depending on the type of prolapse, depends on how I treat it. And the issue with people Googling and looking online is that the info isn't specific for the type of prolapse you have, and commonly you might have a bit of two or one or the other, and you really need to get somebody to have a look, have a feel, see what that prolapse is doing when you're lying down, when you're standing up. Quite commonly for ladies who get their symptoms when they're doing particular gym exercises, I'll be feeling for that prolapse and seeing what happens when you squat, what happens when you stand on one leg, what happens when you run, because we need to treat and manage it specific to you. It can't be just a one-size-fits-all, do your pelvic floor exercises. It's so, so much more than that. So just a little bit about pelvic floor exercises. I don't want to touch on it too much because I think a common misconception is that you come for pelvic floor physio, I give you your exercises and I send you home. It's really not about that at all, and actually for a lot of ladies it's more working on relaxing that pelvic floor or getting it to work in a different way. But as a bog standard kind of takeaway from this, everybody should be doing their pelvic floor exercises, regardless of your age, your gender, whether you've had a baby. Absolutely everybody should be doing them. The way I suggest doing it is from your back passage. So first of all, from your bottom, like you're trying to stop wind escaping, and almost like a zip right up to your vagina, like you're trying to stop urine mid-flow. So it's a nice gentle movement. So I'd really encourage you to have a go at doing those at home. Quite often when ladies try and do it, they'll find that they're squeezing their bottom cheeks together or sucking their tummy in, and that's a sign that actually you're not doing your pelvic floor exercises correctly, and actually there's something internal there that I need to look at. Quite often I get ladies come to see me and they say, well, I don't know if this is going to help, I've been doing my pelvic floor exercises, but when I look and assess and I have a feel of that pelvic floor and I have a feel of their tummy, actually what they've been doing at home for the last 5-6 years is completely wrong. So it's no wonder their symptoms have got worse. So it's really worth coming to see me and let me have a feel and see what is going on. For men, just to touch on it, so yeah, tell all the men in your life partners, they should also be doing their pelvic floor exercises as well. And with that, we encourage it. It's almost like drawing your testicles up, or like you're walking into a cold shower. So that movement again, internally sucking up to get your pelvic floor working. There are a few good apps. So the Squeezy app's a really great one to encourage you to keep doing your pelvic floors, and it will talk you through that. I think that's a couple of pounds on the App Store. And the guidelines say that everybody should be doing their pelvic floor exercises 3 times a day. So 3 times a day, 10 pulses, so squeezing and releasing, and then 10 long holds, so where you're pulling up and trying to hold it for 10 seconds. And the gold standard is that you should be able to hold your pelvic floor for 10 seconds, which have a go at doing it, and I reckon a lot of you probably wouldn't be able to do that, which shows that that pelvic floor could do with some help and could do with coming to see me and see what we can do to help you. So yeah, the take-home message from me is just, as women, I think a lot of the time we prioritise other people above us, and we're busy, we have busy lives, we're prioritising children, work, all these things, we're constantly juggling. But these symptoms are common, but they're not normal. And just because they're common doesn't mean that you need to put up with these symptoms, that you need to suffer in silence, that there's nothing there. There is so much out there. I wouldn't have my job and be doing this job if there wasn't people coming to see me. And I really want to encourage us, especially for International Women's Day last week and this month, to just take pride in our pelvic health and seek the advice and support we need, and take that jump to really look after your body, because you only have one body. And if we look after ourselves now, we're future-proofing our future lives, our time when we retire, when we get older, when we have children. It's what we're here for. So please, please, please do not suffer in silence. Please contact us if you need help. I'm here to help. We do discovery visits, then I can give you a phone call. And then for people that have attended tonight, we're also offering a £20 discount as well. So if there was ever a sign that you needed to see pelvic floor physio, let this be it, because yeah, I'm absolutely here to help. And I hope to see and help some of you in clinic very soon. So yeah, any questions? That's all. Do you have any? Lovely. No questions, but if you do, please contact us, because I'm more than happy to help. And no questions too silly. You've got our contact details up there. Give us a shout and let us know, and talk about us. Talk about pelvic floor physio to your friends, your family, because spread the word, because if people don't know we're out there, they're not going to come and seek the help that we can really offer. So yeah, thank you for attending. No questions. Lovely.